Hi, my name is Tawana Martin German, and I will be presenting my Wicked Problem covering breast cancer awareness and earlier diagnosis in women under 40. As we continue through this tribe talk, please think of how this would affect you if it was yourself, your mom, your sister, or maybe even your own daughter. How many of you have heard that breast cancer only happens to women over 40? How many of you actually believed it? Imagine this. She was 31, no family history, no classic symptoms, just a gut feeling for nearly a year. Doctors told her that she was too young for cancer, and cancer was for older women. That her sharp pain and electric shocks and pain symptoms was not a symptom of cancer. That her perfectly rounded tumors looked too benign to worry about because cancer was jagged. By the time she was finally diagnosed, she was stage 2B cancer, with 5 tumors, cancer in her lymph nodes, and evidence it had spread. That woman was me. I was too young for cancer. I was too dismissed, too unheard, and too late. Today, we are not just here to talk about cancer. We are here to challenge a dangerous myth, break the stigma, and ignite change. The objective of my Wicked Problem is to promote awareness of breast cancer in young women aged 20 to 39 by advocating for earlier testing and alternative diagnostic methods, educating healthcare providers on the risks for younger women, and reducing the stigma that breast cancer is only an older woman's disease. So you may be wondering, what's the problem? Dismissed by the system and the invisible epidemic. The system isn't built for us. Routine mammograms don't start until 40, but cancer doesn't wait until your birthday. It doesn't care about your age, and 9% of all breast cancer cases are in women under 40. The most are found late, aggressive, and already spreading. Women between the ages of 20 and 39 are being ignored, misdiagnosed, are diagnosed too late. That delay costs lives. Particularly those dismissed by providers or without strong medical guidance. There is a growing need for focused awareness, promoting testing alternatives, and saving lives. This year, in 2025, the American Cancer Society projects over 316,000 new invasive breast cancer cases in women. 59,080 new cases of non-invasive in situ breast cancer will be diagnosed in women. 2,800 new cases of non-invasive breast cancer will be diagnosed in men. 42,170 women will die from breast cancer this year. And 510 men will die from breast cancer this year. Incidence is rising faster in women under 50 than over. 1 in 8 women will be diagnosed in her lifetime. And for African American women under 35, the risk is double that than their white peers, and the death rate is triple. Breast cancer is the number 1 cancer in women aged 15 to 39. Yet 9% of diagnoses under 40 are already in advanced stages. 1 in 196 women under 40 will be diagnosed. Most present with an aggressive subtypes are late-stage disease. The impact of this is young survivors face misdiagnosis, expensive treatments, workplace discrimination, fertility issues, and mental health trauma. The economic cost affects families, employers, and healthcare systems, with financial strain and families disrupted. This is not just about numbers. This is about mothers, daughters, sisters, and friends. And the fact that we are losing too many of them far too soon. Behind every statistic is a woman with dreams, careers, families, and so many never get the chance to fight. So you're probably wondering, what's feeding the fire? Here are 7 common driving forces. First being medical bias. Providers are just saying you're too young. Screening policy gaps. Mammograms aren't the answer for young women with dense breast tissue. Social silence. Young women don't think they're at risk. Cultural stigma. Breast cancer is seen as a 40-plus issue. Medical misguidance. Many providers still believe cancer doesn't hurt, or round tumors are not malignant. Testing barriers. Mammograms aren't effective in dense tissue, which is common in young women. Systematic flaws. Insurance policies, diagnostic guidelines, and provider education all fall behind the data. When a young woman is diagnosed late, the toll is devastating. There is the physical fight, more aggressive treatment, higher reoccurrence rate, and often fertility loss. There's emotional toll, anxiety, PTSD, and the fear that the cancer will return. And then there's the economic costs, weeks to months off work, lost wages, lost productivity. Businesses lose skilled talent. Families lose income. The ripple effects reach our healthcare system, our workplaces, and our communities. The more aggressive the disease, the higher the mortality rate for young women. The risk of fertility loss, mental health trauma, chemo brain, lost wages, workplace discrimination, all resulting in national productivity loss from long-term disability. We are not just fighting cancer. We're fighting outdated systems, stereotypes, and silence. So let's talk about potential solutions, from awareness to action. We know what works. We just need to do it. Adopt alternative screenings like automated breast ultrasound, MRIs, biomarker testing for high-risk women under the age of 40, or even in children that have genetic history of breast cancer that runs in their family. Train healthcare providers to recognize early warning signs, even in younger patients. Empower survivor-led advocacy networks to push awareness into spaces young women inhibit, from social media to college campuses. This is not just about awareness. This is about changing systems so early detection becomes the norm and not the exception. We are building a movement, not just a moment, powered by stories, science, and strategy. Earlier detection means earlier intervention, lower costs, better survival, and more birthdays. That's the value. That's the vision. We don't just save lives, we save time, strength, and dignity. Our success is not just measured in likes or dollars. It's measured in lives saved. We are aiming for a 25% increase in early stage diagnosis rates in targeted areas within 18 months. 10 to 15 healthcare providers trained each year in early detection for under 40 patients. 3 or more corporate or insurance policy changes to cover alternative screenings. 5 new partnerships with clinics or hospitals to offer low-cost or free screenings. Published surveys tracking changes in screening behaviors among young women. If we can measure it, we can prove it. And if we can prove it, we can scale it. Here's our execution plan on how we plan to make this happen, from hashtags to hospital halls. A digital campaign to increase reach by 65% in 9 months. Raise $50,000 in 4 months to fund screenings and awareness events. Host monthly survivor-led question and answer and doctor panels. Partner with hospitals and the American Cancer Society and policy advocates to push for insurance coverage changes. We are mixing heart and hustle because awareness alone doesn't save lives, but awareness paired with action does. This isn't just a talk, it's a wake-up call. Picture a world where your daughter, sister, or best friend is taken seriously at her first concern, no matter her age. Every year we wait. More young women are silenced by a system that doesn't see them. I'm here because I trusted my gut. Others don't get that chance. We don't need permission to protect our lives. We need people to listen, to speak, and to act. Here are ways and things that you can do to help make a change. Advocate. Call or email your legislators about insurance coverage for alternative screenings. Sponsor. Help fund low-cost screening programs in your community. Share by telling young women in your life that breast cancer can happen to them and what the signs are for them to watch for. Act. If something feels off, demand your doctor to take it seriously. Don't wait for permission to protect your life. No one knows your body better than you do. We are not too young for breast cancer, but together we are right on time to change the outcome. This isn't just a fight against cancer. It's a fight to be seen, to be heard, and to be believed. Here are the few of the references that was used to make this presentation. I would like to close by saying thank you for taking time to listen to this presentation. And remember, early detection saves lives.